Hi, everyone. This is Andrea Lowe. I'm the moderator of today's session, and I just wanted to welcome everyone to the webinar. We're going to be starting just in another couple of minutes. We're just allowing a few other people to join. So thank you. Great. Thanks everyone for joining. I want to welcome you all today to our webinar on extreme weather events and health system resilience. Today we're going to be speaking about the impact of the cyclones Ide and Kenneth on the health system in Mozambique. These were two devastating cyclones that occurred in the spring of 2019. We're also going to be presenting the results of an evaluation that was conducted of the health system response. That was a collaboration between the Instituto Nacional de Saúde in Mozambique, ICAP at Columbia, and the Earth Institute. Just a couple of housekeeping points. It would be great if people could put their name and their place in the chat if they want to. Also, we have a tab for questions and answers, so we can take those questions and answers towards the end of the session today. And we have translation to Portuguese down at the bottom. It's a little globe that you can press, and that will allow you to choose the language that you want to hear during the session. We're going to start with a video that's going to demonstrate exactly, it's a video from CARE that will give us a sense of the impact, and then we'll have two presenters and finally a panel. So with that, if we could just start the video.
Mvura yakatuka yaguma nousiku. Mwanarume waigogoma gogoma ishikwira pano ziwa muti wetogogoma ishaenda kushina mvura.
Idai wakatambuja maningi majimai edu ngokuti majimai avachakwanise kukwira mudenga.
Waizokwanisa kutora chimwana kako chisungira mudenga, chimweni kako chikwanda kumusana, amweni aitombwerera nokumwa mvuremo.
So thank you again to CARE for providing that video. Although brief, it gives you a sense of just the extraordinary impact and devastation that was seen after these cyclones. So we'll go to our first speaker, who is Professor Chiaying Lee. She's an assistant professor at the Lamont Doherty Earth Observatory here at Columbia University. Her research aims to improve our understanding of tropical cyclones, their physics and relationship to climate, She applies such understanding to predictive models, including those for assessing tropical cyclone hazards. She is also the lead developer of a Columbia hazard model called CHAZ, which is an open source academia model for tropical cyclone risk assessment. So delighted to have you. Thank you, Dr. Lee.
Thanks for introduction. Can I share my screen or?
Yes, you should be able to.
Okay. Hi, great. So hi everyone, I'm Chiaying Lee, and thanks for joining today's session. And I will be report our work on this project, which is conducted with my colleagues, Susanna Camargo and Eden Sobel, and of course with the support from the whole project team. So our component is to discuss the meteorological service and the communication in Mozambique. We have two specific objectives. One is to survey the Cyclone Focus product issued by Mozambique National Meteorology Institute in NAM. And the second one is to understand the communications between INAM to other Mozambique national and the local agencies. We use approaches including interview, literature review, and web search, especially during web search for the available product during a cyclone event during the project. So cyclones are rare to Mozambique, on average roughly 2 storms per year, and most of them are tropical depression. In the past, like recent history, which we usually start from 1979, there were only 7 of them reach the tropical cyclone, intense tropical cyclone strength that is equal to the major hurricane in North Atlantic. And the 3 of them are actually from 2019 and 2022, Andrea just mentioned in the beginning. However, Mozambique is extremely prone to the cyclone hazards due to the low-lying coastal region, and the design of the infrastructure and the buildings is not actually cyclone-proof. And the rarity of the event actually poses challenges to the communication, which we'll mention later. Still, forecast and the communications of the forecast are essential for hazard preparation and mitigate the damage caused by cyclones. When we talk about cyclone forecast, we can discuss by the different lead times. It depends on the purpose. After the initial discussion with the team, we decide to focus on the predictions at the lead time up to 1 week, which is for the near-term guidance as well as for the emergency responses. And for both forecasts, they rely on objective guidance, which is based on the observations and the output from numerical weather prediction systems, as well as subjective interpretation by the forecasters. So INAM as a Mozambique Meteorological Agency are responsible for issue such a forecast. While they do not have in-house numerical weather predictions, they do have access to the NWP information from the local WNO Meteorological Center, La Reunion. So INAM has a standard radio sound and the weather station measurement network, but they do not have modern observation techniques such as the radar system, or their rain measurement is not up to date, which are very important for short-term precipitation predictions. So following the La Reunion, INAM issues 3 days tropical cyclone track advisories as well as intensity. And if they need to provide additional daily locations for day 5 and the day 4 and 5, they can get from the La Reunion's report, bulletin report, as well as a storm surge. But they can still communicate with La Reunion forecasters through emails or phone call to request additional information. There were cases that the system is weak, but has potential impact or threatening to the Mozambique. But La Reunion may not issue advisory, then the forecasters from inland will look into other global weather prediction centers for information, such as joint typhoon warning centers. So while inland did a good job with the resources they have, but still a couple issues were mentioned both during the interview and from the WNO report. I think the most important thing is the lack of funding. The lack of funding is actually lead to the fact that they do not have their in-house regional model. So when we talk to inland people, they ensure that their staff does trained with numerical weather prediction system backgrounds. They send their staff to other agencies to learn those skills so they can interpret the information they got. However, lack of in-house regional modeling definitely hinder their ability to effectively interpret the model simulations. And then that also, lack of funding also one reason that may causing some technical issues with their forecasting system, such as their computer system is not up to date or their internet bandwidth. And also that's one of the reasons they couldn't have a updated or modern observational system. Another issue point out from the WNO report is there are more high level or more like high value products out there that provided for meteorological agencies during the local in that region, but were not used routinely by inland, which is another thing I pointed out. So once after inland issue a forecast, they provide those information to the National Directorate of Water Resource Management, which will run the model or issue the hydrology hazards and the flood risk using inland warning. And both information will be provided to the National Institute of Disaster Management. And then they will provide the bulletins to local administrative agencies and other relevant agencies. Warning is communicated to locals through TV, television, radio, newspaper, and also specific person will receive emails or phone calls. Inland also provide broadcasters on their video broadcasts on their website. Although the social media and the cell phone warning text, which is a common happen in the United States, is not yet in place in Mozambique. And as while talking to discuss with inland staff, they did mention that relative cyclone pose challenging the communication. So for example, like idea and the cadence is just not happening in people's recent history, like memory. People have never really need to face the danger. So this is the sentence I quote from the interview. They said, although the government was willing to act, the community did not want to act. So there's some kind of miscommunication. It's not just about it's about communication, but it's really how the local people, the people's awareness of such event to happen. Still, INGG and the INA have been working towards improving their forecast and warning and the communication to the regional agencies. And here we show work done through the Science of the Humanitarian Emergencies and the Resilience Program that develop a regional focus bulletin showing the key meteorological factors and about the event and the duration and the time, and also the specific flood forecast as well as possible impact. Still, there's a significant gap and weakness in terms of content of the warning and the overall emergency preparedness. And also it's not clear how this type of information was developed after Hurricane Ida and used during the Kenneth will still continue to be used right now. So we have a couple of conclusions that inland forecast would be benefited from additional staff training in gathering and interpret existing data and also conducting the in-house weather prediction system. And in the tropical cyclone forecast product can contain additional risk or impact oriented information. And I think it probably will be benefit as a whole to use and further improve the existing flood management bulletin provided by the I showed in the previous slide. And for the S4S's next step, I think it's important to identify the information needed by the health sectors that so we know what exact information they are seeking for, and confirm the timescale and understand current resources they are using, and of course building up the bulletins that are oriented for the health sectors. I think that's all I have, and thanks for everyone for listening. Yeah.
Thank you so much, Chiaying. That was really interesting. We will now have Dr. Tatiana Marufo. She was another investigator on the S4S project, and she's going to be speaking to the health system response. She is the coordinator of the Health and Environment Strategic Program at the Instituto Nacional de Saúde. And she worked on the first vulnerability and adaptation analysis of the health sector to climate change there. She is also the general coordinator of the Climate, Environment, and Health Research Agenda and the development of the early warning systems for climate-sensitive diseases at INS. So very delighted to have you. Go ahead, Dr. Marufo.
Thank you. May I share my screen? Okay, so thank you once again for this presentation, and I'm going to present on behalf of the group that had conducted this study in Mozambique. And the title of the study is The Impact of Cyclones and COVID-19 on HIV and the health system in Mozambique, a mixed methods study. I am Tatiana Marufo, and I'll be presenting this study for you. So may I introduce this topic, starting by saying that climate change has a profound and escalated impact on the health of the people around the world, and it's not different in Mozambique, since the impacts of climate change affects not only economic stress, migration, forced displacement, but also under access to and engagement in the health services. But other impacts such as damage of infrastructures, interrupt of supply chains, displace of healthcare workers, threatening health outcomes and magnifying some health disparities. So some of the health outcomes that we have looked in this study, it's the HIV. So we can see in this slide that the HIV prevalence in the communities in the cyclone path, it was different in the provinces affected by Cyclone Idai, and even in the province affected by Cyclone Kenneth. And we have a total number of people living with HIV of 350,000 people living. So another outcome is the COVID. So the country are trying to contain the COVID pandemic as of the rest of the world since March of 2020. But as for now, we have a total number of 152,307 confirmed cases and 141 deaths. So in December 2021. I'm showing here, so the number of cases of the past 3 months regarding the COVID. As you can see here, I'm showing that the the capital cities of the country are the hotspots for COVID, and still the hotspots for COVID as for now. So the health system needed to restrict access to the routine services because of the pandemic as part of mitigation strategy and for control of the COVID-19, and with negative effects on the utilization of HIV testing and even for the treatment services. So our objective in these projects, Solutions for Sustainability, was to evaluate the response of the health system in Mozambique to the catastrophic cyclones that Chia have already mentioned, Idai and Kenneth, that occurred in 2019, and the ongoing COVID pandemic. So we aim to identify the strengths and gaps in the health system response to the 2019 cyclones, focused on the continuity of care for chronic diseases such as HIV. We aim also to explore the effects of COVID pandemic on the health system, and even to understand whether lessons had been learned from the cyclones on how to manage chronic diseases during the emergencies. So in terms of methodology, we conducted interviews between February to May 2021, and we use key informants, which mainly were composed by policymakers and healthcare workers provided by the Instituto Nacional de Saúde. Regarding the sampling, we use a snowball sampling for the recruitment of provincial and district level healthcare providers, managers, and policymakers based on feedback from the key informants. We also use an electronic questionnaire that was distributed to the staff of the World Health Organization and even to CDC and other stakeholders involved in the response to these emergencies. We also use a focus group discussion in which we had 3 mixed gender groups that were recruited via informational or healthcare providers who use a standardized recruitment script. So these groups were people living with HIV, people living with non-communicable diseases, and even people attending other outpatient clinics. So in terms of analysis, we develop a code book using a deductive coding derived for teams in the questionnaire and inductive coding derived from review of the transcripts. So in terms of the sample description, we had a total number of 53 key informant interviews distributed from 3 provinces, so Sofala, Cabo Delgado, and Maputo. In terms of electronic survey, we had a count of 23. And in terms of focus group discussion with clients at the health facilities, we conducted 3 focus group discussions distributed for 3 cities, so Beira, Pemba, and even Maputo City. So I'm showing here a focus group discussion in Sofala, and we had a little bit of delay in terms of conducting these focus group discussion at the health facilities because of the restrictions of the pandemic, so the social distancing, as you can see, the use of masks, so it was a little bit challenging for us to conduct this at the health facility environments. In terms of findings, we divided out our findings in terms of the perspectives on the healthcare system response to the cyclones, and even the perspectives on the healthcare system response to the COVID pandemic. So regarding the cyclones, I'm showing here, as you can see, the destruction of the health facilities, so the impacts, even the severe flooding in Beira. And it was reported as for one of the members of the focus group discussion in Beira that there is a damage of a lot of things in these provinces. So here I'm also showing the displacement of people in Cyclone Idai, and once again, the impacts. So we can see here damaged roads in Beira after the Cyclone Idai in 2019. And in Pemba, some of our members of the focal group discussion, it was particular someone living with HIV, saying us that the fact that people had to move or to move out of the neighborhood was, turns out that it was complicated in terms of getting the medication for his disease or for his chronic disease. So in terms of findings, we divide our findings in terms of positive perspectives and perceived challenges. In terms of positive perspectives, we have things that were issues that were related to quality of services, so the dedicated healthcare in face of personal loss, and even the management of cholera outbreaks. So some of the perceived challenges were related to the difficulties of assessing health facilities, the destruction of health facilities, and even food shortage. As for our KII's perspectives, we have that most of them refer that the government leadership was favorable during the cyclone, and even a strong political will and local was possible, even with limited resources. Of course, we have a lot of problems with the supply chain and logistic disruptions that impacted directly the clinical care because of the destruction of the infrastructures, of course, and even the pharmacies and the stocks at the pharmacies. But most challenge that were feared by our KIIs was that, for example, related to people living with HIV, regarding the missed appointments and even the patient discontinuation in terms of care. So regarding the perspectives on health system to the COVID pandemic, we also have some positive perspectives in terms of effective and rapid communication, a small death tool compared to the other countries, and even the differentiated service deliverers was appointed from our clients. In challenge, they were referred that the economic impact, the restrictions to the impacted transport to the health facility and work, and even the non-compliance to government restrictions were challenging for the clients of the health facilities. So even regarding the COVID pandemic, the KII perspectives, we had has findings that effective response were that we have an effective response overall. So including the dedication to the protecting healthcare providers, for example, that were prioritized for vaccination, and even the thing of having stockouts or the stocks of ART were sufficiently well managed to ensure the multi-month dispensing, so this could be supported because of the stocks of the ART. So it was notable disruptions to the healthcare services because of the burden of the COVID in terms of patients. Of course, it was reported a number of healthcare providers a reduction, so because of the infection or fear of the exposure, the limitations in terms of stocks of personal of PPE, and the policymakers also recognize the negative impact of mitigation measures on communities and their economies. So in terms of conclusions of our study, we think that in future responses to the natural disasters, frameworks for the mitigation of climate change are being developed in Mozambique at different levels, so at local and even at national government level. So to strengthening the country's response to future disasters, it could be better to implement early warning systems that allow for predictions, including the pre-ordering and distribution of medical supplies and other commodities will be, of course, essential for an effective response. So as for a few adaptation measures in terms of incorporating into training curricula for health workers and policymakers, this change may take time to be adapted, of course, and even to scale up. And we also think that additional research needs to be focused on determining the most effective and, of course, more sustainable interventions to face this kind of events and even the impacts of those events on the health sector. So I might stop here. Thank you again. And I have my acknowledgements for all the team involved in this study, starting from the people in country. So the Instituto Nacional de Saúde team, the ICAP Mozambique, the team of interviewers, of course, the team from ICAP New York, the Mayo School of Public Health, Morehouse School of Medicine, and definitely the Heart Institute. Thank you. Muito obrigada.
Thank you. Obrigado to you, Tatiana. Thanks. And to reiterate, anyone with questions, please put them into the Q&A. Now, unfortunately, due to time constraints in terms of Dr. Eduardo Samagudo, I'm not going to provide extensive bios on our panelists right now, just to give him a chance to answer before he has to go to another meeting on COVID. But today, we're very lucky to have our panelists with us. We have Dr. Eduardo Samagudo, who is the Deputy Director of the National Institute of Health in Mozambique, and he was one of the leads in the response to the cyclones of 2019. So welcome. We have Professor Janito Maure, who's a climatologist and professor at the University of Eduardo Mondlane in Mozambique. He specializes in climate adaptation and modeling of the impact of climate change across Southern Africa. We have Mr. Waltaji Kutain, who's the Technical Officer for Climate Change and Health at the WHO Country Office in Mozambique. And he has specialties in water, sanitation and hygiene, sanitary science, and human ecology, as well as the emergency response epidemiology. So, and finally, we have Dr. Erica Rosetto, who's a field epidemiology trainee program resident advisor for CDC Mozambique, who has also a very diverse background in pharmacy and biochemistry, epidemiology, and tropical diseases and international health. So thank you so much for joining. I will start first, Dr. Gudo. I am very interested in consideration both of what we've discussed earlier and also in more recent events, including COVID. What are some of the activities that the National Institute of Health and the health system in general in Mozambique are engaged in right now, just broadly thinking about health system adaptation to these extreme weather events?
Yes, good afternoon. Okay. Yeah, thank you. First, I would like to thank you for this invitation. It's an honor for me to be part of this excellent panel of those experts on climate and health and epidemiology. So going straight to your question. So I would like to start first by mentioning some of the challenges we have faced in Mozambique in terms of climate, extreme climate events and health, climate and health. So I will mention four, but there are more. First is there is a lack of awareness in Mozambique on climate change or extreme climate events and health. Not common. It's not common that people address this in their routine planning, their routine activities in countries. So second is there is also lack of skill on that matter. So if you have to do something, you have to have skills. And then probably we believe that lack of skills is related with the lack of knowledge and is related with the low awareness. So the third is there is a lack of evidence. So you need to have a guide, and then evidence is what guide you. tells you where you are, what are the problems, and then you can plan and then strategize. Fourth is that there is a poor incorporation of climate change and extreme climate events within the health policies and planning in Mozambique. So those are the four main challenges I would like to address. And then some of the actions that are on in place, they are in parallel with those challenges. So I will mention a few of them. So first, I think my colleagues, they will talk more about in more detail about that. Dr. Genito has been deeply involved in that activity, is that the drafting and approval of HNAP. So that is an important tool, what will drive effort to build capacity to ensure that there is capacity for prevention, preparedness, response, and resilience on the impact of climate on health. So second, so this is a well advanced process is pending at this time approval. Second is that there are, since I say that there is a lack of evidence, so it's important that we address that matter. And then we start by drafting the first ever, the National Research Agenda on Climate and Health. That is quite advanced as well. Indeed, Tatiana is coordinating this activity. So indeed, I am coming here to mention activities that I'm not implementing, those that are in this panel and the presenter, they have been implementing. So the reward is for them. So the acknowledgement is for them. And then this research agenda on climate and health is critical for the country because this is what will define the priorities for evidence generating, but it's key also, it's key for fundraising and advocate for more investment on research and surveillance on climate and health. So another activity is the build of capacity in country for forecasting. So anticipating what will happen in terms of disease and other health impact based on what is expected in terms of the climate is critical. So I see one of the first panelists that mentioned that there is a need to strengthen the Met Institute, that they are able to better forecast. So that means that we depend also on the building capacity in country for the climate and health and forecast. But this is a quite complex process. It does involve modeling so that you can, based on what you have as assumptions, to anticipate what's going to happen. So we have built in Mozambique, we have what is called National Health Observatory. So within the National Health Observatory, we create a platform. It's a kind of observatory for climate and health. Indeed, Tatiana is the person that coordinates this platform. It involves several institutions, including Met Institute. And then this platform is where those forecasts are done. And then the Met Institute is definitely key for that. It's a joint effort. So INS alone, MOH alone, they cannot do those forecasts. We have been doing this, if I'm not wrong, for 3 years that we have been able to do. And then Tatiana, she used to every year, 2-3 months before the rainy season, around October, I think it's September indeed, there is a national meeting that is chaired by the Prime Minister in country. He coordinates this steering committee on that, where different sectors, they present what are the actions that will be in place to respond to next rainy season. And then Tatiana is the one that present on the health. She mentioned what are the initiatives that are on, and then she present what are the foreseen changes in terms of disease. So last and not least is the training. So since, as I mentioned, one of the challenges is that there is a poor skills in country on that matter. So there are activities that are ongoing in terms of training health professionals. And indeed, we were able to incorporate within FLTP training program, the training for field epidemiologists. there is a module that we incorporate on climate and health. Over.
Okay. That's excellent. Thank you. And so thinking about training, I wanted to ask Mr. Chiaying, I know if you can tell me a little bit about some of the capacity building that the WHO is supporting in Mozambique.
Thank you very much.
Okay. Oh, sorry.
Yes.
I thought it was.
Yes.
I apologize.
Sorry. Thank you very much. I think Dr. Eduardo has already said what I was supposed to say. So I'm going to emphasize some of really what he has already mentioned, and we are doing on the ground this thing. So for me, we are focusing, it's not as such there is no particular WHO activity. The activity is led by the INS, and then to some extent by the Ministry of Health Environmental Department. And also we are closely working with the Edward Orlando University, where Dr. Genito, Dr. Tetinia from the INS is very active. We have, we call it, we have the TOR, we call it this technical work, core technical working group for the climate change in the health. This is a special name we give to ourselves. So when it comes to one of the basic things, as we are focusing here on cyclone, on the vulnerability in the adaptation assessment, which has been started in late 2018, and then almost done in 2019, and then 2022 particularly. Those vulnerability adaptation assessment was identifying, in addition to the climate change and overall extreme weather event, adaptation, including the adaptive capacity, managed the vulnerability to cyclone, to drought, and then also to the floods. So we found in that evidence the need of proactive adaptation plan, which is already finalized now, waiting for the endorsement. This last week, it has been submitted to Ministry of Health, this national adaptation plan. We call it proactive adaptation plan. So this plan identifies what has to be done to the long-term climate change, and then to the extreme weather event, cyclone, drought, and the flood. So we call them the proactive adaptation at district level. So including the health system, the health program. This is not really a separate thing, but with the mainstreaming, the extreme weather event to the health programs, such as HIV, reproductive health, the surveillance system we are having, particularly on the surveillance for malaria, dengue, and then furthermore to chikungunya with the INS. The process of mainstreaming and the piloting in province is currently happening, including doing on ground, like in four provinces, where building the capacity at the province and the district level, including the provision of the IT equipment, the capacity building on ground. So these are the two areas, as has been mentioned by Dr. Edward, the lack of awareness. So in the recommendation the awareness raising on the importance of the proactive adaptation plan is need to be strengthened for the decision maker, health workforce, experts, and also for the community. I think in one of the first presentations, even if the government is willing to act, the community is not acting when it comes to the alert, responding to the alert. So the community level intervention is very important. As I said, the proactive adaptation has to be done at the community level. This includes awareness raising, and then establishing the system, and then also building the capacity of the health system. These are very important, we have seen, and then we are working on it. We recently, before 3 days, there is different partners who are trying to support the resilience of the infrastructure, especially like the UN Habitat with some huge resource. They are doing, but they are looking only at the infrastructure. We had a discussion before yesterday with a big team with the WHO. We need to look at the all components, the human resource, the infrastructure, and then the innovation and the technology, because we cannot only talk about the building in the resilience, we have to talk the full package. So this is also a kind of gap of awareness also, as Doctor has already mentioned, because of the lack of capacity. We are looking at a single component. So we are trying to address comprehensively through the adaptation plan. So the other point which I would like to highlight is, in addition to the capacity building and awareness raising, is the multi-sectoral coordination. There are different response to this cyclone with the different partners and with the government also in the health sectors, including the infrastructure improvement, to leverage rather than duplication and also scattered response. There is a need of strengthening the multi-sectoral coordination with a comprehensive planning, which includes the decision-making, the technical expertise, and also the people who are doing on the intervention. So there is a need for the multi-sectoral coordination, having a comprehensive joint planning to respond in a comprehensive way. Lastly is the active resource mobilization. There is a resource problem also in this area, in resourcing a comprehensive, like this assessment is coming. I was consulted on the assessment which has been presented by the CAF and by the university first. It is good. They are looking at HIV and other disease, but looking from comprehensive, the program. The whole idea of the climate resilience and the extreme weather event is to mainstream the extreme weather event and the climate change to the existing program. So does the existing program going to function during these extreme weather event calamities? So that is the question, really very important. Yeah, thank you.
Yeah, thank you very much. I'm so sorry.
The point, yeah.
Unfortunately, we only have a few minutes left, and I really wanted to hear, I know Janito has actually has led on one of these health vulnerability index assessments. And one, I was hoping we could put up a slide of one of the more recent assessments just to give an idea of what this looks like. And Janito, can you describe a little bit the process on how you generate these indices?
So good afternoon, good morning, everyone. Thank you for having me here. So basically, we used a WHO recommended methodology for the determination of the HVI, the Health Vulnerability Index. And we did this for each district of the country. This is the first time ever in Mozambique that we conduct such an assessment of vulnerability district-wise. So in this methodology, the vulnerability is defined in terms of three parameters. This is a definition from 2007 from the IPCC, namely exposure, sensitivity, and adaptive capacity. So by exposure, many of you may know this, it represents the magnitude of the rate of change of climate parameters over time. And also it takes into account the occurrence of and frequency of extreme weather events. For sensitivity, we look at the degree to which the systems, both natural and social, on which the health status of population depends, are sensitive to climate. And by adaptive capacity is a group or a set of institutional and social capabilities and resources that can enhance the capacity to adapt to climate variation over time, to extreme events. So this is a mathematical formula, a simple one. IVS is defined as the difference between exposure and adaptive capacity and multiplied by by the sensitivity. So in terms of of these indices, they are composed, they have got components. For example, we've got variation in temperature and occurrence of extreme events for exposure. For sensitivity, we have a range of, let's say, ecosystem geographical risks. For example, the occurrence of cholera outbreaks and so on, occurrence of food insecurity episodes, and so on and so forth. For sensitivity, we could also bring demographics of and vulnerable population, proportion of vulnerable population due to health conditions, financial resources, health, access to health services, human health, human resources, and so on and so forth. This is the adaptive capacity. We also include water and sanitation and social determinant of health. So we've got indicators for each of these components. So they are put in an Excel spreadsheet, and that Excel spreadsheet does a simple calculation based on the formula that I tried to explain. So because this is a methodology that will is supposed to be sustainable, what we did was to provide a table that we used with those indicators to the staff of the National Institute of Health. And they have been prepared, they're trained to update the sub indicators on a systematic basis. So what they're doing now, they're now in process of generating an automated HVI map. Every time that an indicator is changed on the spreadsheet, the HVI map automatically updates itself and becomes visible for the decision makers. So any country, I mean, basically can conduct such an assessment, provided that indicator data sets are available. Just to mention that this was one of the major constraints that we had on this assessment. So as a summary, I would say that although we cannot change exposure and in short-term sensitivity, because this requires a lot of intervention, but we can act on the adaptive component, adaptive capacity component. So yeah, this is what I would share for now. Over.
Great. Thank you so much. And for those who don't speak Portuguese, so it's the dark red that indicates the most vulnerable places, right? The most.
Yes. This is a vulnerability index which shows, I mean, from the light to dark colors, the intensity. I mean, the lowest to largest vulnerability to climate. So in overall terms, the country is highly vulnerable to climate, for the health sector especially.
Wow. And I think you had an indication there that urban areas seem to be less vulnerable. Is that correct?
Yes, there is a high contrast between urban and rural settings. So if we look at the map from the results that we got, our 75% of the urban setting, the urban districts are less vulnerable. The top 75% least vulnerable districts are urban. So that gives you an indication of where to look at.
Great, thank you. I have a final question for Dr. Rossetto, and people can stay on a couple of minutes beyond the end of the hour. Because we have some great questions in the Q&A box. One about extreme heat and whether that's being incorporated. And then also someone would like you to share the tools, Janito, so maybe we can provide information from that on our website after this. But so Dr. Rossetto, in terms of the Centers for Disease Control, and obviously it's a global public health organization, has there been any lessons drawn from the experience in Mozambique, a high HIV burden country, experiencing these devastating events? Has there been anything in terms of policy and programming that's been developed there for health system resilience more globally?
Hello, thank you for the invitation. It's a pleasure to join this panel with high-level discussion. Professor Janito, I'm so glad to see your presentation, the Vulnerability Index. I was deployed after the Cyclone Lee and Kennedy, and our first step was identify the most vulnerability areas and the factors, and try to identify chronic patients for treatment plans, mainly for HIV, and prepare the color response plan. So now, straight to the question about the CDC. So we consider that health system resilience is a key to learn lessons from counter response to crisis. So we faced the Idai and Kenneth cyclones in Mozambique and COVID recently. Lives were lost, public health systems collapsed, and the country faced economic and social disruptions. So the CDC worked closely with Instituto Nacional de Saúde and Ministry of Health in both situations, following the lead and providing support to national government with a scientifically sound response. So CDC believes that it's important to enhance the capacity of a stronger local primary responder. We prioritize developing and strengthening institution and social health actors' capacities to be prepared to observe the first impact, while maintaining core functions with the goal of serving the ongoing and acute care needs of their communities and helping those communities recover. CDC works under the pillars of addressing governance and financing, training and preparing the health workforce, providing medical products and technologies, and deploying experts to support the country public health functions in the field, health service delivery, and community engagement to prevent and mitigate the hazards. So our main lesson learned is the necessary to develop capacity building. It's over. Thank you.
Great, thank you. It's interesting. Capacity building really seems to be the common thread. That, and I think the lack of resources globally, unfortunately. But just a question, I know, Janito, you might be able to answer this about how heat waves, are they being considered as extreme weather events? And if yes, what are the challenges with regards to forecast warnings on heat waves in Mozambique? And this is from Carolina Pereira, Magadan. So thank you for the question.
Thank you very much, Carolina. Obrigado. Yes, in fact, what we did for this study, we looked at at droughts, floods, and cyclones, not the heat waves per se. But as I said, this methodology allows for the inclusion of other climate indices, if you want, as long as you've got the data. In terms of forecasting temperature, temperature is one of the easiest, even in the IPCC projections. The projecting temperature is the simplest one apparently. What is most difficult would be to project or to project precipitation, because there are many unknowns in the physical laws that govern the formation of precipitation. So the heat waves would be, for example, the number of consecutive days where we have a temperature above a certain threshold. Yeah, if we can predict the temperature easily, then we can get to heat waves, find a definition for specific for Mozambique, because that, of course, that is region dependent. What is a heat wave in Mozambique or in Maputo is not a heat wave. Or in Maputo is not a heat wave in Tete, for example. Tete would be, facing heat waves or during the whole summer. So yeah, so there is still room for inclusion of other variables or other indices. I hope that clarifies or answers to your question, Carolina. Yeah.
Yeah, thank you, Janito. And as we mentioned, we'll try and provide links through our website.
Hello.
Hello, yes.
Yeah, I want to come on this issue because when we started this vulnerability, this was part of the discussion, and the problem with the heat wave was there is no data. That was one of the problem. Even in some of the area for the health epidemiological data, we have a data problem. So this was part of the discussion when we started the training the national people to do these things. It is the data problem. Even the data is there, the heat wave was supposed to be considered. So that is what I want to just add on this issue. Thank you.
Thank you. So I think we're a little bit past the hour, so I wanted to just thank our panelists. This has been such an interesting discussion, and I'm really happy to learn about all the programs and so on that have been developed in terms of the climate change response in the health system. I also want to thank our two speakers, Chiaying Lee and Tatiana Marufo, all of our participants in the project, our key informants and the focus group discussions. And then finally, I really wanted to extend a thank you to the Earth Institute, both for this collaboration as well as for supporting the Solutions for Sustainability project. And of course, thank you to everyone who attended. And I think we will have a recording of this. So if anyone wants to share this with any colleagues who are unable to attend, that should be available on our website. And the Solution for Sustainability reports will also be on the ICAP websites as well. So if anyone's interested in reading further on this matter. So I think that's it. Thanks very much. Obrigado.
Obrigado.
Thank you. Obrigado. Thank you.